I would like to welcome back to the show Dr. O. She has a background in integrative medicine as well as conventional medicine. The last time we caught up, you were giving us an overview of integrative medicine and how that's applied to numerous things. Now, today the topic is autism. There's so much that the average person, we just don't know about it. So Dr. O, let's just start out with the definition. What exactly is autism?
Autism, or ASD, autism spectrum disorder, is referred to a broad range of conditions in children that we see impairing their social skills, and they have more stereotypical repetitive behaviors and a speech and nonverbal communication disorder and considered as a cognitive impairment. But not to forget, some of these children have a lot of other skills and actually make them much smarter than neurotypical children, but then they may have some other areas of difficulties.
And we always talk about being on the spectrum. What exactly does that mean?
That's a great question. And I personally feel like if we are on this world and exposed to all the different environmental factors, our genes are responding to environment with epigenetic expressions. So just let's talk about epigenetics, and it's a new term, and it's basically how our genes are expressed in the environment with the environmental factors. So what is being on the spectrum? Maybe we may be all being on the spectrum, but some people are more neuroatypical. So the difference between typical and atypical became such gray zone within the last, I would say, 20 years, because there's a huge increase in 1990s to early 2000, increased neuroatypical behavior that we are seeing in these children, and just made us think that this is a spectrum. But then most of those children have a lot of skill groups that maybe you and I don't have. So what I think is we have to look at it as more inclusive rather than exclusive, and understand what are the strengths, what are the weaknesses, and how we can remediate these in the current environment that we live in.
And that's why it's important for us to have topics like this and share, because a lot of people, they just don't understand really what it all entails. Now, you mentioned that some people that are on the spectrum, they might actually have some type of benefit from it where they excel in an area where other people do not. Can you give me an example of what that might be?
I mean, some of their memory. I mean, some of these children, just like in Rain Man, and remember the big movie, and they have an incredible memory. And they also may pick up on non-social cues, and they're just super intuitive. And I really enjoy interacting and learning from them. And what we call today neurotypical, to me, is just boring. And when we look at the full spectrum and look at like what difficulties that we might think a normal person going through, sometimes it's just okay to be atypical. So we have a greater understanding of the perspective of expression of our genes or our neurological expression of our genes.
Now, what about with integrative medicine? Again, it's an area that you practice. Is there anything that you are applying from that background that's helping out with autism?
Yes, and integrative medicine and use tools that we talked earlier about. And one of those tools is functional medicine testing that we do in those children. And over the years in the functional medicine research are showing some of the environmental factors we look in. And like in environmental factors, what's being addressed about the flame retardants and triclosan and association to some of the autism outcomes is being mentioned and is being studied and still being researched. There are a lot of grants and looking through different organizations. So when we look at the environmental factors, we see sometimes consistent environmental risk factors in these children, and those are the tests that we sometimes tap into. Another thing is what we look at methylation defects. Methylation is a one biochemical marker that we look and how we are actually assimilating our fats and carbohydrates and the proteins to take energy from those micronutrients to take that into our Krebs cycle where we make energy. So we see consistent patterns of the Krebs cycle disruptions in those children. And when we talk about Krebs cycle, I don't want to talk about jargon, but it's where we get our gas for the car to run. And we see consistent patterns in those children, how they metabolize their fats and proteins and carbohydrates, and how it kind of tickled down to the Krebs cycle. Or we look at some of the environmental disruptors, then how, and they might be feeling maybe more tired, they're easily exhausted, and they're unable to get restorative sleep, and they're not able to easily detox. So say, then when we look at those functional labs, we see those markers and we support those broken pathways, and we see some great outcomes from those interventions, and often we see improvement.
Yeah, I mean, that's pretty fascinating. So basically, you're breaking it down to the diet and seeing how they respond to different things, because that's the source of energy. If you're not getting the right energy, where you're going to have crashes and highs and lows. So that makes a lot of sense. One of the things I want to bring up, we were talking about this before we started this interview, PANS and PANDAS. What exactly is that, and how does it relate to autism?
And that's another growing group of neuroatypical behavior. When we talk about PANS and PANDAS, we need to look at the sudden onset of behavior change. So that's kind of differentiation from autism, which is a slow, insidious, and neurodevelopmental kind of demise or regression. And it's kind of where just sometimes not seeing those changes overnight. But when we talk about PANS, which is pediatric acute neuropsychiatric disorders related to strep, after strep exposure, like a strep throat, acute strep infections, those changes overnight and sudden change in their neurological behavior could be somewhere between the regression and temper tantrums and aggression and the food aversions and sleep disruptions. And those are the behaviors that we see in that group of children.
Now, as a parent, if you feel like your child is on the spectrum, what are some things you should be looking out for? And at what point is it time to see a physician like yourself?
The average age, the autism and autism spectrum children are picked up somewhere between age 2 to 3, but there are signs and very subtle signs of these disorders before even age 18 months. There are studies looking at the infant eye tracking and picking up their symptoms from lack of eye contact, eye tracking, and social smile, and engaging emotionally with their parents. Those are the signs and symptoms. Around 12 to 18 months of age, and you see kind of more like temper tantrums and not engaging, not tracking, not pointing, not waving, and then not really doing those like patty cakes and blowing a kiss and social play. Those are the lacking social skills in those children between 12 months and 18 months that we need to pay attention. If the kid is really pointing and tracking with their eyes, waving hi, bye, socially engaging around 12 months of age, that's the age group we expect that behavior. And I'm comfortable that, and there are also checklists that their pediatrician can provide parents, and, MChat and one of them could be used to just track those kids and pick them up 15 to 18 months of age as early as we can actually give those questionnaires.
Dr. O, thank you again. We always learn so much whenever we're talking with you. If people would like to learn more about you and your practice, where can they go?
They can go to Dr.O.Jax.com or obtainhealth.com. And our newsletter is building with all this information as we're getting it released shortly.